Hi there, I'm Dr. Bomboni. Thanks for coming in. Please have a seat. Thanks. So, how are you feeling today? That's great to hear. Oh yes, that's very important. What have you been up to? That's very good. It is important to work on your mental health. I do agree. Yes. Good for you. I'm proud of you. So what is the reason for your visit today at the ENT Doctor's? Yes. Okay. You've been having issues with your sinuses. Oh, right. Okay. Ah, yes. Yes, it's common. Don't worry about that. Tonsil stones are very, very common. There's nothing you need to fear there. Yes, it can cause issues sometimes, but it's not too much of a nuisance. It's just typically because food gets trapped back there and you just have to squeegee it out. Yeah, it can be uncomfortable for sure. Yes, if not done properly, you can actually do more harm than good. So you came to the right place. I'll go ahead and check out what that could be for you. Okay. But you said sinus as well. What would you describe your sinus issue to be as? How does that feel for you? Interesting. Okay. So I hear you saying when you blow your nose, it feels like you can hear kind of like a squeaky sound in your mind. Yes. Okay. That's probably bubbles being trapped or some form of inflammation. We'll see. But do you have pain right around this region? Okay, good. And does it give you a hard time breathing? No. Okay. We're going to see what's going on. All right. Have you been having all right vision? Have you recently been to the optometrist to get your eyes checked? Yes. Okay. And what did they say? Did they refer you here? No. You just want to make sure everything's all right. Okay. Did you have them dilated recently? No. Okay. Good. Okay. I just want to make sure because that would, I don't want to shine a certain light if that was the case, and it's still not to cause irritation so soon. I'm going to open this right here. Actually, I don't take care of eyes. No, I'm a ENT. The E stands for ears. Okay, it's ear, nose, and throat. Yes, if you think about the holes in your head, right? The passages, yes. But I still ask for eyes because these can also influence your vision in some way because it's still all connected to your head and your face. So, yeah. I just thought I'd show you that these are some signs and symbols. This is a normal eardrum, how it's supposed to look like. This is what an ear infection looks like. An eardrum perforation, and your ear tube, if it sticks out, and an earwax occlusion. All right, so I want to look for that normal, healthy eardrum. I'm going to use my otoscope. Have you ever worked with an otoscope before? I'm sure you have when you visit your doctor growing up. Probably just don't remember. So I'm just going to pull out this little cloth here. And wipe this screen a little, okay. This is what that is. Yeah, I'm sure you've seen it, I'm sure. This is typically what they use to check your eardrum, really, growing up when you had to get your exams for school or whatever, Yeah. So there you go. It just is a light, all right? You can see that light. That's all it is. So I'm going to go in your ears and check to see what is going on exactly. Okay, first I'm gonna check your eyes just to make sure everything. Can you just follow this light real quick for me? Thank you. Kind of like how they do a cranial nerve exam, right? All right, I'm not going to go too deeply into it though, because you did just get your eyes checked. So I'm, again, not an optometrist, ENT doctor only. So going through your ears, you could just bend your head down a little bit slightly this way for me. Thank you. So I can just see what's going on in there and examine healthy amount of hairs in the ears. That to me looks pretty good, like a healthy eardrum. Yeah. That looks pretty good to me, in all honesty. Your left ear looks great. So now I'm going to go ahead and check your right ear. Okay, just going to feel a little bit of a pressure as I go in there with the tube. There you go. Take it easy. Be still. Have you been having hearing issues, hearing loss, pain in your ear, like a sharp pain? Okay, I am noticing a little bit of a clogging in the right ear. Just a tad hinge. I would recommend you go to an ear cleaner. They can professionally clean out your ears just to get all that excess wax out, and liquid, and if you use Q-tips, just to get all of that cotton out there so that you can hear better and your ears can perform better. All right. Do you listen to loud music often as well? Do you have dizziness, vertigo symptoms? Okay. Do you tend to have a lot of your wax on your Q-tips? Okay. And do you play some type of sports at all that requires the use of your hearing frequently, or the use of your voice, like singing, instruments? Okay. So even shouting? Okay. Just making sure so that I know exactly what to expect and the reason you might feel what you may be feeling. All right, so it seems perfectly healthy, but yes, I would do that. I would not do the ear candle by yourself. That's actually damaging. That can pull out too much wax, even the good wax that's supposed to protect your eardrum. So I would get it professionally cleaned instead. All right, and you'll notice the difference in the relief you feel, for sure. All right, so I forgot to actually check your eyes furthermore, so if you could just do me a favor with this tool. I'm going to cover one eye, and then you just follow the lights, okay? That was just a mistake on my part. I do apologize, okay? All right, covering your one eye, and you're just going to follow that light. You're going to follow that light. I'm just going to continue following that light for me, okay? You're doing great. Continue following the tip of the otoscope, and then cover your other eye. All right, and then you're going to follow that light again. You're going to continue following that light. All right. Follow the light. Follow that light. Okay. Perfect. All right. That's all for that. So I checked your eyes and I checked your ears. Now I'm going to check the nostrils. All right. So if you could just lean back a little bit so I can get in there. All righty. Let's see in there. Getting in there. And there. Good. Stay very still. I know it's uncomfortable. I just gotta check in your nose. Alright. Okay. Yes, I know it's very deep in there. Okay. Good. And we're gonna slowly pull this out. Okay, perfect. Now I'm going to check your other nostril, so please bear with me. I have to go slowly just to make sure everything looks good. All Nothing too concerning. I did kind of see it needs to be a little bit cleaned out, but that's okay. I'm actually going to go ahead and do that now, and while I do that, I'm going to take a sample. So it's going to be a nasal swab, and I'm going to take an oral swab as well. I'm going to put these gloves on. Right. Yes, after the nose, I'm doing the mouth. And we don't actually stick the camera up your nose to go down your throat unless we actually see that there is an issue. I did notice a little redness, but it's not too bad. I think what you're more feeling is the pressure of the sinus, just kind of like, sometimes you want to do like a little sinus massage like this, okay? So you rub, we're all bones and meat really under all this facade, so if you just figure out the anatomy of how your bone structure is, there's something right here that you can actually squeeze and rotate like this with your middle fingers. You can do some rubs here. You can do some qigong massage. Okay, so there's a lot you can research. Now I'm going to print out those research papers for you to be able to do from home, so you don't have to concern yourself with that, okay? But no, I don't think you need any meds. I don't think you need a prescription in particular. I'm not going to have to send you to the pharmacy unless I find something else going on. I'll call you, of course, once we get the samples going, okay? Yeah, you're fine. Exactly. Okay, so I'm just gonna do a nasal swab, so you could just lean back a little bit. You don't actually have to lean back if you don't want to. Whatever's comfortable for you. I'm just gonna go right in there. All right, perfect. And just swab it. Just a nice little nasal swab. One end and out. There we go. And I'm gonna take this to the lab, and we're gonna figure out exactly what's going on. Okay, because sometimes you could have like a parasite or infection, God forbid. So we just want to make sure it's not that. I know no one likes to be swabbed. I think we've got sick and tired of that. So I understand. Okay, let's do this right in there. Okay. I know, just hold on a little bit longer. There's some blockage or intrusion here, I know. Let's see if we can clear it out while I do the swab. Feels better? Yeah, there you go. If you have a runny nose, you can use those tissues there. All right, perfect. We got exactly what we needed. I'm going to go ahead and send this to the lab now, and yes, it will be perfect. Yeah, sure, you can use this if you'd like to clear out anything. You want me to help you? You're going to do it yourself? Okay, there you go. So I'm going to go ahead and just check your mouth now. Let's go. Once you're done clearing out your nose there. Okay. Wide open. Perfect. I'm just going to check around to make sure you're okay. Do you bite your cheeks a lot? All right. I'm still going to have to take a sample to make sure there's no cancer cells. You've been to the dentist lately in the last 6 months. Okay, make sure that is up to date. Your oral health and hygiene is important for many reasons. Ah, yes, I see those tonsils. Well, I don't really see anything right now. I think you're clear. You've cleaned up the stones. Okay, good. Do you feel like pressure in there, like there needs to be an extraction maybe? There's a little more? Certainly I can check for you. But for the time being, I don't see anything concerning. You're eating a healthy diet. Average, okay. Your tongue and the back of your throat looks all right. No inflammation. Yeah, your gums look okay. I don't think there's anything concerning really today. You're in luck, so I'm just gonna take a cheek swab. I'm gonna just go in the cheeks. There we go. Yes, this one is a lot more comfortable than the nose one. Absolutely. All right, I'm gonna put that down there. And then we're gonna go to the other cheek. Yes, all right. So, unless something's wrong, you won't be hearing back from us. All right. Yes. No news is good news, as they say. Let me just check real quick, just to make sure. Unless you want to do it yourself. You want to poke at that tonsil back there yourself. Okay, there you go. There you go. Yeah. Sure, I can shine the light to kind of guide and support you. You can use that mirror right there. There's a compact mirror. Just to help you find your tonsil if you need. Nope, nothing in that one. Try the other one. Nope, nothing in that one. You're good. Yeah, I don't see anything. I think you're healthier than you think. A lot of times, people come in with all sorts of issues and, you know, yeah, you're doing just fine, honestly. I don't believe there's anything you should concern yourself with, okay? If there is a genuine concern, always feel free to call back in and we can actually stick that camera down there and then determine if there is actually truly something that we need to take a look at. All right, you have a nice day. Yes, thank you so much for coming.